Hi guys, welcome back to the masterclass on post burns neck reconstruction. We are in the discussion section, and for the ease of convenience, for ease of our understanding, we have broken down the discussion part into preoperative considerations, intraoperative considerations, and the postoperative considerations. So in this section, we will be dealing with the preoperative considerations, everything related to decision making as to why we do it, in what sequence we do it, whether we use a skin graft or a flap or some dermal templates. We will be discussing it in this particular section. So first we will discuss the timing of release, whether we should release when the scar is immature. So our traditional or conventional teaching says that we shouldn't operate when a scar is immature, because when a scar is immature, the myofibroblasts are still in a very active stage and it leads to a rebound contracture. So immature scars, when clinically examined by blanching, are a big no. So that was the conventional teaching. But what recent literature and recent sort of experiences have suggested, that even in immature scars, when you release the scar and when you put in a graft over there or resurface it either with a flap, FTHG or STHG, the recurrence rates are minimal if good postoperative care is taken, good splintage is given. So you can go ahead even when the scar is immature. What my personal belief is that, especially in case of neck contractures, early on when the scar is immature, I would say in the first 6 to 9 months, I am very reluctant to go in and operate at that particular stage unless there are a lot of functional problems to the patient. So if the patient is having functional issues, we go in and tackle it at that point of time. If there is a minimal contracture, patient is doing the activities of daily living comfortably without any issues, we prefer to wait for the scar to be mature and then go ahead with our reconstructive procedures. Now coming when not to release. So this is also a very important question. These patients, burn contracture patients, tend to have multiple contractures number of times. They have been operated, they have been admitted number of times. So understandably their hemoglobin is less, their protein levels are less, and if they are not yet optimized to undergo a surgical procedure, it is best not to operate at that point of time. If the hemoglobin is less, if the serum proteins are less, it is definitely not the time to operate, because we land up in raw areas, we try to resurface them, we end up with more raw areas and graft loss. So that is the area when we prefer not to release a contracture. Then coming to things to do during a waiting period. Generally what happens is, when these patients come to us, we tend to give them a date, that is especially in public sector hospitals or government hospitals. Even in private practice, when these patients are not yet optimized, we tend to give them a date, maybe 2 months.